Hi, everyone. I'm Adam Barta, Associate Athletic Trainer at the University of Toledo. Today I got Dr. Chris Winter with us. He's going to talk to us about sleep and some ways that we can help our sleep during this COVID-19 pandemic. So start with a little introduction. Dr. Winter is a neurologist and sleep specialist at private sleep clinic down in Charlottesville. Has worked with numerous professional athletes and professional teams around the country and the nation. And then is also the author of the Sleep Solution. Thanks for joining us today, Dr. Winter.
Thanks for having me, Adam. It's always a pleasure to work with the University of Toledo.
First off, we all know that sleep's important, but talk to us a little bit more about why it's so important, what the benefits of it are, especially in our certain circumstances with the COVID-19 pandemic going on.
Yeah, I mean, I think you can think about sleep almost like you think about nutrition. If somebody said, why is it important for us to eat healthy foods? I mean, you could probably speak all day on that topic. It's in terms of our where our bodies are built, the way our bodies function, our health all seem to sort of, stem from good nutrition, but also really from good sleep. And when you start looking at all the different things sleep does for us, both in the immediate, like how well we feel the next day, how well we train the next day, but also in the long term. I mean, it's sort of an endless answer. For your athletes, it's very important for them to be able to perform their best, to make good decisions both on the field and in the classroom, but also for them to take care of their bodies. It's really important. Sleep really plays into our ability to recover from the things that we're doing both on and off the field. And, in this time of COVID, we've really had this kind of renewed focus on sleep really interact with our immune system to not only
Mhm.
keep us healthy and keep us from getting sick, but God forbid, should we get sick, sleep plays a huge role in our ability to recover from that. So there's a direct relationship between sleep and our immune system. And so it's really important that in times like this, we're making sure we're covering our mouths, we're staying away from other people. Sleep to me is another thing that we have control over, that's important for us to pay attention to do everything we can to keep ourselves and others from getting ill.
And then obviously now with all this going on, everyone's got a little bit of extra stress. What advice do you have for everyone who's having difficulty sleeping because of that added anxiety?
Yeah, I mean, it's tough, particularly for the people that you're working with, athletes who are used to really an intense level of training, and they're going to classes and having to get up early and get to their 8 o'clock, philosophy class or whatever. And suddenly we've lost a lot of the anchors of our schedule. We don't have to get up early if a lot of times things are more virtual and whatnot. I've got a college student living with me right now, and it's definitely a much more flexible scenario for her. But also, taking away some of that elite level athletic training, and now you're kind of stuck in your apartment or your home. These things really change the way we not only develop sleepiness during the day, but also kind of get rid of a lot of anxiety. Exercise is a fantastic way to reduce anxiety and stress. And now we're just at home with Dr. Fauci telling us things that are terrifying, and you may be living with your parents and your classes are kind of all over the place, and you're not able. I've got a son who's going to swim next year in college, and he can't get into a pool. And so, being with a swimmer that can't get in the water is a nightmare, just to let you know. So a lot of your athletes are kind of dealing with these types of things. So to me, I think the most important thing is to really try to recreate as many schedule markers as you can. So listen, you don't have to get up at 7:30 every morning, now that you're out of school or whatnot, but trying to not sleep until noon is a really positive thing. Because what's happening with a lot of people right now is stress and anxiety makes it hard for them to fall asleep. So they stay up and watch a couple extra episodes of Succession as watch that HBO show. And now they're up till 3. Well, they're not going to get up at 8 because that's only 5 hours of sleep. So now they'll sleep till 11. So now for the first time you're seeing sunlight at close to lunchtime. You're eating food for the first time at 11. You're not exercising until later in the afternoon or early evening. So everybody's schedules are kind of getting flipped around, which is not helping people sleep. So if you're somebody who's struggling with your sleep, really trying to pay attention to that day's start time and try to recreate some of those things that you had in your life before. If you were somebody who had an early morning lift every other day, maybe get together, get a Zoom meeting going and put it down where you're lifting. And even if you're just lifting dumbbells in your bedroom or whatnot, organize your friends. Hey, we're going to get together. We're doing a virtual lift on at 7:30 or whatever. Or a virtual push-up competition, or people are being really creative with those kinds of things. And even if you're not lighting the world on fire, you're still social. You're still getting up at the same time. You're seeing light for the first time. You're getting your body warm at the same time every day. These things can have tremendous implications in terms of your sleep later on in the evening. So I think it's time, that we're kind of settled into this process and kind of over the novelty of it, to really use our creativity to kind of bring together, in a team-like atmosphere in some cases, ways to sort of inspire. Let's have a team lunch, a virtual team lunch. Everybody sits around with their microwave burritos and talks about things that are going on. Social interaction, light, exercise, meal timing, all these things are going to make your sleep better and frankly your anxiety better as well too.
Really important to keep that routine and schedule and just trying to incorporate that structure that you used to have during this time into your routine, even though that might be.
It is, and it's really interesting to see young people want it. Like I've got a 16-year-old, an 18-year-old, and a 21-year-old in the house right now. And so for the first week, it was like, this is the best thing in the world. No school, whatever, even though the world is ending, like they're, this is great. And then as time passes, it's interesting to watch them start to seek these kinds of things. Hey, mom, can you get me up early? I don't want to sleep until 11 o'clock tomorrow or whatnot. They did a really interesting study a long time ago with kids where every time there was a meal, they took them to this cafeteria that had every food imaginable. And for the first week, the kids would only eat desserts. Like they weren't told you could eat whatever you want. They'd go right to the pie and cake and cookies. Then after a few days, they started eating vegetables. They started balancing their diet without anybody telling them to do so. So I think we've got that intrinsically within us. And then when you take a team aspect like you're dealing with, that support can be really positive as well too. So the other thing I would say too, just to kind of build on that really quickly, is really focusing on the schedule. And once the schedule's in place, not worrying too much about whether you sleep or not. So if the schedule is, I'm going to go to bed at 11, get up at 7, if it takes you an hour to fall asleep, that's okay. Just building the schedule and sticking to it, even if you have a good or bad night, that will tend to balance itself out. And watch out for big naps during the day. That can disrupt people as well too.
So, I mean, I think we kind of covered a little bit of this, but I mean, is it normal for people's sleep to be disrupted now, having a really difficult time sleeping? And then, kind of along with that, I've kind of heard some people saying that they're having a lot more dreams than they normally have. Is that a good or bad thing? Is that normal?
Yeah, I think that the dreaming thing is interesting. When you look at somebody's sleep, we tend to spend the most part, first half of our night in deep sleep, and as the night goes on, we have a lot more REM sleep during the second half of your night. And our biggest cycle of dreaming or our biggest cycle of REM sleep generally happens right before we wake up. So if somebody's on a pretty decent schedule, like your players, maybe every morning they're in the weight room at 7, or have some sort of team meeting. And so they're very used to getting up at 6:30, getting dressed, having a shake, and being in the gym at 7, for instance. Our
Mhm.
bodies, once we're on a schedule, will really start to map out our sleep so that we have that big cycle of dreaming and then we transition out for a bit of light sleep and then we wake up. When you start to change randomly that wake up time, okay, today I woke up at 8 and I got to wake up at 7 because we got a Zoom meeting with the team, but on Friday we don't have anything, so I sleep until lunchtime. When you start altering that wake up time, that can have us waking up during REM cycles. So that irregular wake up time will tend to lead to more dreamings. Also, anxiety does it too. When we're stressed out about things or things feel out of our control, we're a lot more likely to have dreams where we're in a building where we can't get out of it, or I bet a lot of your players are dreaming that they're being expected to take a final exam for a class they didn't even know they were enrolled in. Like, that's always my dream, that if somebody says, hey, the finals exams today and I haven't gone to class all year and I didn't even know, and like, and you wake up like, oh, thank God. So a lot of those anxieties that we have will come out in our dreams. And so I think those things are pretty natural as well too. I will say a lot of people are drinking more in quarantine. I don't know if it's a way to deal with stress or something to do. Let's have beer with dinner. Alcohol can affect our dreaming as well. So, I think probably a combination of those factors are probably what's throwing people, but it's not necessarily a bad thing.
Another one I had for you here is, since all of our student athletes now switched to remote learning, there's a lot more screen time with their cell phones, computer screens, TV screens. How does that play into all this, and how does that affect sleep?
It potentially has a huge effect. I mean, depending on how much screen time, the people who are watching this are exposed to. I mean, I can look at my kids and even myself. The screen time has really gone up exponentially. I'm seeing all my patients now via telemedicine. All their classes are via, computer. A lot more flexibility in terms of timing of things. And so any light that we're seeing has the potential to disrupt sleep. So if you think about a typical day in the morning, there's a lot of sunlight and it's bright. That tends to suppress melatonin in our body. As we move towards the evening and towards the night, the sun goes down. That loss of light is a really strong trigger for us to sleep. So if the loss of light is never happening, we're never developing a full melatonin response to our brain. So to be, typing up a paper and it's really stressful, and your boyfriend, your girlfriend keep buzzing in as you're typing and telling you stressful things, and I think maybe we should take some time off or something. You're like, wait a minute, no, I don't want to take time off. And you're trying to get your thesis statement put together. And then you shut your computer off and try to go to bed amidst a global pandemic. That can be pretty tough. So if you're somebody who has difficulty limiting your screen time, there's certain settings you can put on your computer to dim the screen. So my screen at 10 o'clock gets really dim and really pink. And some phones do that too. The blue blocker glasses are fantastic. So, if you're just in your own apartment or your own home, and nobody really sees you, you put these little blue green glasses on. They have these little yellow lenses, and they keep that blue green light from getting into your eyes and disrupting your sleep. So that's a nice thing, just to get into a habit of every night at 9 o'clock. Pop them on, keep doing your literature, your history, or whatever you're working on in your computer. And that way, when you do shut the computer off, your brain's a lot more ready to go to sleep. And you can even use that if you're just watching television or something like that, if you're somebody who
Sure.
struggles to kind of wind down before you go to bed at night.
Yeah, to bring it all together, I know you hit on a lot of really good stuff and a lot of good ideas to kind of help everyone with their sleep. What's your big take home message and your biggest tips to help everyone sleep better during this time?
I mean, I guess tip number one would be schedule. It's really important
Mm,
that you
right.
understand that in this time where we can introduce flexibility. And if I think back to myself as a college student, I would have laughed at a doctor telling me, "Hey, you might want to create a schedule." Like, screw you, old man. Like, that's not what college is
Mm,
about. So I think that if you're somebody who's struggling with it, give it a week. Like, do an experiment for a week. Try to get up, exercise first thing in the morning, even if you have a exercise session later in the day. Even if you're just taking the dog for a walk, try to eat your meals at the same time. Really try to, sit out on a deck or a balcony or just out on a front on your lawn in a lawn chair and sit there and do your anatomy reading or your communications homework on your computer. Then after dinner, really pay attention to the lighting in your home. Even if your parents complain, just walk around and turn off lights. Here's a fun project. Get on Amazon, order some dimmer switches and install them around your house. And after dinner, really start to dim the lights in the evening, and see what effect it makes in terms of your sleep. Do it for a week. And if you don't think it's making much of a difference, you can go back to what you're doing before. But I think schedule is a big take home. I mean, I think really trying to set aside the time to sleep. There is a lot of temptation, I think, right now where I could stay up a little bit later. I could keep, playing, Fortnite with my friends. Could watch another episode of this show I'm binging because I don't really have anything that I have to get up for tomorrow. And I think that trying to avoid those types of situations are really
Mm.
important. Stay connected with friends and family. Social interaction is a huge component to our psychological well being, but also to our sleep. Watch out for alcohol. I think those are big take homes. And then, if you're feeling a lot of anxiety and stress, just keep in mind that you don't go to Bowling Green, and that's something that I think all of your students could be really happy about and feel good about in this time of chaos and stress.
That's right. That's right. Well, awesome. I think that was some great information. I really appreciate you taking the time to be with us today. Hope you and your family are staying well.
Absolutely, and yours too. And if your athletes have questions, you feel free to reach out to me on email or Twitter or whatever. I'd be happy to help them out, and hopefully they're feeling healthy and feeling good through all this stress.
Okay, perfect. Thanks, Dr. Winter. You take care.
Hey, my pleasure. You bet.